On today's Two on Your Side Town Hall, the death of Colin Powell from COVID complications after he was fully vaccinated has questions running rampant about vaccination effectiveness. We are separating fact from fiction tonight and getting some answers. Plus, being black in Buffalo gets harder. A look at research across decades showing a troubling downward trend in the Queen City, a closer look at what's at the center of it and what needs to change. And less than 3 hours to kick off now, Vic Carucci will be here to talk about what to expect tonight and where things go from here for the Buffalo Bills for the rest of the season. And we thank you for joining us tonight on the Town Hall. I'm Kate Welshofer. Michael has the night off. We want to start with the news that came as a shock to a lot of people in Washington and beyond today. The death of former Secretary of State Colin Powell due to complications with COVID. He was 84 years old. And what surprised a lot of people was that he died despite his family saying that he was fully vaccinated. They did not say if he'd had a booster shot, what complications he had, or whether they were related to his battle with multiple myeloma, a white blood cell cancer. But that cancer was shown in a study to reduce the immune response from COVID vaccines. So joining us live right now to talk more about this is Dr. John Selleck, epidemiologist for Kaleida Health. Dr. Selleck, thanks so much for coming back. We appreciate it.
Thank you for having me again, Kate.
And you know, it really didn't take very long for some people to see this headline today and say, see, this is why I don't get vaccinated. I can get the shot and I could still die. So what is your response to that line of thinking?
No, you're absolutely correct, Kate. This is an absolutely stellar individual with a stellar career and accomplishments, and that became the main byline that he was fully vaccinated. So we have to go back to the fact that all of these vaccines, all of our vaccines, but including the COVID-19 vaccines, nothing is 100%. And we know that not everyone responds to them. And as you point out, people with multiple myeloma and other blood malignancies do not respond as well as other people. Even after the booster dose, a number of these people get up to about, maybe 80 or 90% protection, but it is still not 100%. So I think what everyone has to look at is that nationwide, we have almost 200 million people vaccinated. I think it's something like 187 million people vaccinated. And the number of deaths in vaccinated people is less than 30,000, which is a minuscule fraction of a percent. We see the same thing in Western New York. We have more than 500,000 people vaccinated and an extraordinarily small number of breakthrough infections that result in death. If you look at what we're seeing in the hospitals right now, the majority of hospitalized patients are unvaccinated, and especially those patients in the ICU, the vast majority are unvaccinated. So if you're vaccinated, your chances of either getting hospitalized or dying from COVID-19 are still on the order of at least 10 times less than if you're unvaccinated.
And it's something that we've talked about so much here on the Town Hall, but we still hear from a lot of people who ask why vaccinated people should be worried about unvaccinated people. You know, after all, if you have the shot, you're protected, right? So how do you address that? And as long as this virus has this opportunity to continue to spread, does it continue to put people at risk, whether they're vaccinated or not?
Yeah, this is very important. I think that we got a little bit complacent early in the year because when the Alpha variant, the one that was originated in the UK, was dominant, it looked like the vaccine actually prevented people from spreading the infection. But now with the Delta variant, it is so efficient at spread that we see even vaccinated people who may have very mild infections or not even have symptoms with their infections can then spread the infection to other people. And that's why it's so important for everyone to get vaccinated, because we have lots of people who are being treated for cancer, who are on other immunosuppressing drugs for inflammatory bowel disease and rheumatoid arthritis and other things. They don't respond as well to vaccine. So we have an obligation to not just to protect ourselves and our families, but to help protect those other people who don't respond as well to the vaccine.
Again, questions we're seeing time and time again. We appreciate having a bit of perspective tonight. Dr. John Selleck, thanks for joining us.
Thanks again for having me.
Next on the town hall tonight, I want to turn to another topic. It's one highlighted by our nonprofit partners at Investigative Post in an article over the weekend. A study from UB came out this past week looking at the situation for Buffalo's Black residents in terms of things like employment, health, education, and poverty. And this was a follow-up to a study on this same topic done in 1991. And what it found was that not only have things not gotten better for the Black community, things have actually gotten worse in those 31 years. So what can we take away from this? We're going to bring in Mark Shear, a reporter at IP, to talk about this with us. Thanks, Mark, for being here.
Thank you, Kay, for having me.
And we want to talk first about just the results of this study. What did researchers actually find?
Well, the researchers built upon some work that had been done 30 years ago by UB's Center for Urban Studies. And that study found that if you lived in Buffalo and you were a Black resident, you suffered from a lot of things like high poverty, high unemployment, lack of educational attainment, and that sort of thing. This study, 30 years later, looked at many of the same things and found basically the same results. African-American residents in Buffalo are still dealing with high unemployment, high rates of poverty, lack of educational attainment, and basically what they found in general was things have not progressed for Black Buffalonians in the last 30 years.
You know, we like to think that things get better over time. So the results here can be, maybe kind of surprising, definitely depressing. Did the study shed any light on why it's happening still and why it's getting worse?
Well, the researchers found 7 what they identified as root problems. There are a lot of things that we've heard for many, many years. Things like residential segregation, things like lack of development on the east side is something that was really highlighted in this report. Essentially, this report focused on the east side as one of the issues where they said, lots of parts of the city have grown, or there's been a lot of focus on other parts of the city like downtown and the waterfront, but the predominantly Black east side is still basically the way it has been for the past 30 years, and in some cases worse. The main researcher on this project, Dr. Henry Taylor Jr., he found that one of the most shocking things for him was the lack of educational attainment component. And what he found is many Black residents over 25 have some college experience, but they had not obtained their college degree. And what happens as a result is that very often they end up stuck in low wage jobs and they can't really get out of that cycle, is essentially what they found.
So the natural question here is, what do you do with this information? You now have the data to support that things are getting worse, but are there any recommendations in this study on how to move forward and actually reverse the trend?
Right. Well, on the educational attainment front, they'd really like to see local colleges and universities do more to retain Black students, or try to get students who maybe left college to come back and finish their degrees. Because if you get a degree, chances are good you're going to have a higher wage, which is what, that would be very helpful in this case. The study focused a lot on the east side. They really would like to see more attention to the east side, more development, more redevelopment efforts on the east side. And essentially, the bottom line here, though, for them was this study was done 30 years ago, essentially. And there were guidelines and recommendations then that researchers found weren't followed at all. And what they would really like to see is that city leaders today pick up where this study has taken them and just kind of follow those recommendations and start really just sort of addressing the problem. Poverty is an issue, unemployment's an issue. Start to really focus on it and take the steps that need to be taken to make a change.
Certainly an important topic, especially with the contentious mayor's race right now. Mark Scheer writes for our partners at Investigative Post, and you can see more of his work at investigativepost.org. Thanks again for joining us.
Thank you, Kate. Have a good night.
Thank you.